and welcome to the Doctors Roundtable, where today we are focusing on the connect between children and COVID. How secure are our children? How much at risk are they? What's the treatment for children affected by COVID? To answer all your questions, we are joined by a stellar panel. Professor Shefali Gulati is Chief Child Neurology Division, Department of Pediatrics at All India Institute of Medical Sciences. Dr. Ming Lim is Pediatric Neurologist at King's College London. Dr. Amit Sen is Child Psychiatrist. Thank you all very much for joining us. Let's go without further ado to all the questions that we have that are coming in. And I want to raise the first question that a number of people are concerned with. And Dr. Lim, you may want to take this first. Are children at lower risk than adults? Is that very clear that there is limited risk to children when it comes to COVID?
Sure. So I think you would take the answer in two ways. Children are definitely at lower risk of catching COVID if you look at the numbers. So percentage of children catching COVID is low. The severity of children catching COVID is also lower than in adults. But of course, you must also bear in mind that children can get a very severe form of COVID, which is this multi-inflammatory syndrome that children get. And I'm sure we'll discuss that, a little bit later on, particularly with the Indian experience.
The multi-inflammatory syndrome that you just spoke about, that's in fact one of my questions that I want to raise next, because a number of people are asking, and since you, why don't you expand on that, Dr. Lim? What is multi-inflammatory syndrome? What are the symptoms we should be looking out for as parents?
Sure. So the multi-inflammatory syndrome is a syndrome that is particularly peculiar to the COVID infection. And children often get this infection about 2 to 4 weeks after either catching COVID or being in contact with COVID infection. And the system that are affected are everywhere. So you get inflammation systemically, you get a high fever, you get very unwell, you get a shock-like symptom as if you've got infection. And sometimes, because we're neurologists and Dr. Gulati as well, Professor Gulati, we see that it can affect the brain as well. So it's a multi-system affecting brain, heart, sometimes the kidneys, and sometimes the way the body functions because of a profound inflammation that the body mounts. We still don't really understand why that is, but I think because we've seen many cases now, we're learning how to effectively switch off, the inflammation.
Linked to that, Professor Gulati, is a question that's coming in. Are asymptomatic children more likely to get the multi-inflammatory syndrome?
It's nothing like that. It is just that, there is an immune response of the body. And as the Dr. Lim has said, that it generally has preceded by either a COVID infection or an exposure to a COVID family member or somebody at home that is there. So basically, it is the immune response of the body which is coming up. And this is because of the immune response, all the manifestations are taking place, which shall be multisystemic. So it doesn't, sometimes they may not be even, they may have either antibodies positive or they may even have a PCR positive, and few percent they may not have either of them positive. So it is, and it is not related to whether it was, so that obviously somebody may be asymptomatic. That's how you never came to know about it. Right. So it doesn't matter that whether it was asymptomatic or symptomatic, either ways. And sometimes you may have PCR positivity continuing when you are having this.
What's the treatment, Dr. Gulati, that you recommend for children for this multi-inflammatory syndrome, and importantly, should this treatment take place at home or in the hospital?
See, one thing is there for generally for whenever you have that COVID positivity, we understand that you can be at home and it has to be symptomatic in those mild cases. And then they have been told the red flag and all, if the fever persisting and the oxygen saturations dipping and all, and then you have this, you start the oxygen and you would admit them and give steroids in those few proportion. And those who are having any comorbidity underlying, you ask them that they can preferably be hospitalized. This is as regards COVID-19 positivity. But if anybody is having a fever duration of more than 3 days and maybe having any other symptoms, which may be cardiac, maybe neurological symptoms, or any multi-system, or towards going towards hypotension, reduced blood pressure, going for shock, and any of these situations, in that situation, they have to be investigated and has to be seen. And if they are mild, if there's a mild affliction only, then it can be at home and can be given on, oral steroids. But
Right.
if there is, it's a moderate to severe, then you will need to be hospitalized.
Just linked to that, Dr. Lim, and linked to my first question, which was whether children were at low risk to COVID, which you seem to suggest they were. Would I be right in saying that therefore the treatment for children should be very different to adults in any way, Dr. Lim, in your view?
Sure. So that I think the thing to remember is that there are two types of treatment. The one type is to actually reduce the infection, reduce the viral load. So these are antivirals that you hear about. And the second is to reduce the immune response. And this is what Professor Gulati was talking about in terms of the steroids. And it's just also to remind ourselves, as Professor Gulati was trying to tell us, is that standard clinical care is also very important, the supportive care when a child is, particularly sick. Right. So whilst we switch off the inflammation, we need to support, the child's body get better.
But Dr. Lim, there's a worry, and this is a question coming in, is that will the steroid treatment that you're talking about in children make them prone to obesity later? Is that a concern, Dr. Lim?
The doses of steroids that we give are over such a short period of time, so I wouldn't automatically be worried about it causing obesity later on.
Okay. More questions coming in now to all of you. Dr. Lim, you may want to take this as well, where on COVID treatment, when should a child be tested for COVID, as there may not be any symptoms, and is the treatment for asymptomatic and symptomatic children very different?
Sure. So firstly, the child should be tested for COVID depending on what the local situation is. If you are testing for COVID, mainly for infection control or making sure that we can stamp out infection, then we predominantly test symptomatic children, particularly those who are in hospital or those children who have been in contact with other children who are positive, so that we can contain the infection. So that's one need for testing. The second need, of course, is that children going into hospital, because you don't want to put the rest of the hospital at risk if a children is infected, so that we can actually take good precautions for maintaining the infection. So the answer is that it is a balance between the ability, the capacity to test, and also the importance to test. Of course, if you're very sick and you're very unwell, and the tests can predict or help you decide on the correct treatment, then you should test those children as well. So it's a combination.
I'm for a moment also going to come to the mental side of it. Dr. Amit Sen is with us, and there are lots of questions on that aspect as well, Dr. Sen. One of which is, what are the symptoms that parents should look out for to understand that their children could be going through some stress in COVID times? And they're linking this to the idea, how do we create an emotional safe zone for children at home, Dr. Sen?
Yeah, so there are two parts to the question, Rajdeep. So the first part, of course, is to do with what you pick up. In the beginning, we find that children's natural rhythms, they start going all right, like the sleep pattern and the eating habits, etc. And then come the mood swings and the behavioral difficulties, where they become oppositional. They could be temper tantrums. The younger kids then could start complaining of physical symptoms like stomach ache, of feeling nauseous, or not being able to get up from bed. And the older ones, of course, then you see more of the oppositional behavior, where they withdraw. There can be symptoms of anxiety and depression that can start coming in at that time. Many of them begin to withdraw from people at home, and increasingly get into their screens of various kinds. And of course, ultimately, they can get into more serious things like substance misuse and deliberate self-harm. So there's a range of things that can happen. And
so how do you create an emotional safe zone? How do you create an emotional safe zone?
So for that, of course, we have to make a space at home where we can listen to children and listen deeply with our hearts, not just our ears, and not just with the intention of finding quick solutions for them. So when children understand that what they're saying will be heard, understood, and respected, and not looked over or ridiculed, then they begin to open up. And it's vital that kids do, because they're going through so much of confusion, stress. They're getting all kinds of information and knowledge from different sources. And if they can't process it well, if they can't share it with anybody, then they carry it in their beings, and that can begin to then show all a range of psychiatric symptoms.
Right.
So it's again very important to create that emotionally safe zone where we listen to children with our hearts, accept that they're going through difficult times, not react to their behaviors, but look at the feelings that are underlying, and also do that with a degree of respect and trust.
Okay, so I think you've given us a sort of overview of how parents need to deal with children. We are getting more questions on the risk to COVID, because Dr. Lim started out by saying our children are at low risk to COVID. But Dr. Gulati, there are those who are asking that in India in particular, will the third wave, if there is to be one, affect children more, as some are suggesting, or is that being alarmist?
Rajiv, can I just add on to what Dr. Amit was saying? Because we just did a study,
Sure.
and 15 studies from 10 countries and 23,000 children, and we found that 79.4% of children had one or more behavioral problem, and out of which 34.5 were depressed percent, and 41.7% also were very anxious, and so you have inattentiveness and irritability, and 22.5% had fear of COVID.
Okay.
So why I'm adding on to this, because they all
22.5, no,
keep
important.
listening to
You said 22.5% had fear of COVID.
COVID, yeah, and I have
So therefore-
79.4. Yeah.
So how do you
we have
link
to-
it to my question, which parents are asking, should they be afraid that their children could get COVID in the next wave?
Yeah. So that's what I'm saying, that they are all exposed to media and all this discussion. So this study was done before the second wave, right?
Right.
So now they'll be more scared. So one thing is there is one study which was been done by AIIMS, in which, if we have seen the seropositivity. The seropositivity was seen in the age of 2 to 17 years of
Yes.
children, which was 55.7%. And in adults, it was 63.5%. This is an answer to your question directly. So if the seropositivity in the population is already 55.7% in the children in certain areas, they did in 5 areas, right?
Right.
And in adults is 63.5. So it's not much difference, right? So although we don't have immunization vaccination is not there in children as of now. So that is why we don't think that there is going to be, excessive surge in the second wave. And even in the first and second wave, we had similar percentage of children involved. 12% of children were involved under 20. The numbers appeared more in the second wave because the overall numbers were humongous.
So would I be right in saying, Dr. Gulati, that while they are at a low risk to getting COVID, are they at a low risk to getting severe COVID? They could get the infection, and the symptoms could be presumably common cold, which lasts for a few days, but they are less likely to get into a hospitalization situation. Am I correct?
Yeah, you're correct, because there are two things. The virus enters through the ACE receptors, right?
Yes.
The ACE receptors are lesser in children, and children are also getting normal immunization for the other vaccine preventable diseases, right?
Right.
And they also keep getting a lot of viral infections. So they have some higher innate immunity than the adults otherwise.
Okay.
So these both things give them a protection sort of to all the other infections, for them to get less of corona. For the coronavirus is not only for the this coronavirus, the SARS-2, but the other ones also, they have had a lesser infection.
Okay.
And they have seen that in a household, when you are having the infectivity rate, the chances of a child getting infected when you have a case positive in the family versus an elderly is very low. The odds ratio is only 0.26.
Okay.
And so they are, why these numbers were very high this time, because most of their numbers were very high. So they were not getting, adults were not getting quarantined. They were quarantined at home. And quarantine actually means you should have a separate washroom, bedroom, everything, which is not there in much of our Indian houses,
No, that's
so
what I
it's
wanted
not
to
a
ask you,
proper
Dr.
quarantine possible.
That's what I want to ask you, Dr. Gulati, a quick answer to that if the parents get COVID,
Yeah.
should the children be completely quarantined from them? Isolated?
They ideally should. They should be ideally done. And when they say that there are small children, they should be, contacted through the FaceTime and all. We have all the mobiles and all. They should be quarantined completely. They should be.
Completely
And that is why we
quarantined.
got many children getting infected. And when they were infected, you were right, they are less symptoms, less severe symptoms.
I also want to raise a question that, yes, Dr. Sen, very quickly.
Yeah. So very quickly, I wanted to say that, the effect of the fear, and the anticipated, chaos that might ensue in the third wave, and the paranoia that is being whipped up causes so much of anxiety that could cause a pandemic of emotional difficulties in in young people. And also the protocol of separating children when they get COVID can be equally traumatic. And that's the other thing that as the medical community, we should be thinking about as to what happens when little children do get infected by COVID. Do we take them to a ward and isolate them? Because that in itself can be more traumatic than the infection itself. Those are considerations we have to have. And I think that as teams of doctors, we have to think through the protocols that we have made for adults. They might not work for children, do you know?
Dr.
Rajdeep,
Lim,
I may...
very quickly, ma'am. Yes, again.
Yeah, just 1 second. When we hospitalize the small kids who get COVID, right? We are hospitalizing them with one of the parents. If the parent is positive, fine. Even if the parent is negative, with the PP kit,
so no isolated ward. Never keep
they are
children.
Not isolated.
Okay, they're not isolated. Importantly, I want
to
to also understand because Dr. Lim, what should parents monitor if their children are getting COVID? Is there any particular things they should be monitoring, Dr. Lim?
Yeah. So I think as mentioned already, when you get COVID, majority of children will have symptoms of the cold and symptoms of the flu. So they have fever, they have, cough, sometimes they have diarrhea and vomiting. But I think the key, and I think most of us who are doctors and most of us who are children's doctors, we rely on the parents. They have a gut instinct to know when the child is not well. But the warning symptoms are if the symptoms persist, the fever is very high and it persists, the cough gets worse, the child becomes a bit drowsy, not quite awake, cannot take fluids, that's when they should worry. And depending on where you are and depending on which your healthcare provision is, whether you go to a local hospital or whether you go to a larger hospital where there is care, that would be dependent on, and that's something that, Professor Gulati and, Dr. Sen is better to comment on. Yeah.
Dr. Lim, I just also wanted to understand this masking. Should children, when they go out, be going out with masks like adults?
Yeah. So I think, again, this is more of a, societal question rather than, science, based. One, children don't tolerate, masks, as well. We also know that children are less symptomatic compared to adults, meaning that they don't cough, they don't, produce lots of aerosols, sort of viruses, and the viral load is a little bit, smaller.
No, but what would you recommend? Would you recommend them that they wear masks to whenever they are going out anywhere?
So I think for us, if they can tolerate the mask, children should wear the mask no differently to adults. But if they don't tolerate the mask for a whole host of reasons already mentioned, then I think it is we allow them not to wear the mask if they're under 12 in the UK, but it's recommended that any child that can tolerate wearing the mask should wear the mask.
Dr. Gulati, you want to step into that?
Yeah. For the Indian Academy of Pediatrics says that 2 years and above children can wear masks and they should be encouraged to wear masks. For children who are less than 2 years of age, we should not cover the child, but cover the baby carrier, if suppose you have to take the child out and never leave it unsupervised. So the child's, the masking 2 years and above.
Let me come to you very quickly.
And if you use a face shield, you can use a face shield, and the face shield has to cover till the ears and till below the chin.
But
so
but you agree with Dr. Lim that it should be if they can actually, if I'm a 4-year-old child, would you suggest that a 4-year-old child go to, let's say he or she is flying off with her parents somewhere, should they be wearing a mask?
Yes. Yes, they should be, and they're tolerating, they're liking it, you're getting them different colors and all, they're trying to, the problem is coming for those who are with special needs, who do not understand, with some cognitive impairment or some autistic features and all that. Problem comes there.
Sure, those are real concerns. I'm coming to an issue which is a huge debating point at the moment in India and across the world. Should we be considering reopening schools? Dr. Sen, why don't you start, because the mental aspect is as important here as even physical health. Children have been at home for 2 years almost, or 18 months certainly. They want to go to school, play with their friends. Should we be now considering seriously reopening schools? If, as Dr. Gulati and Dr. Lim and virtually everyone is suggesting, children are less likely to be severely affected by COVID.
Yes, I think it's shameful that we have not been able to cater to these basic need of children. When after the first wave, when things started opening up, businesses opened up, travel opened up, recreation, pubs, bars, gyms, everything opened up, but schools didn't. And that goes to show how much we reflect on children's well-being and what it does to their development. There's been a huge hue and cry about how all kinds of development, whether it be social, emotional, educational, motor development. All that is getting affected when the children are staying for weeks and months on end at home and have no avenues to actually engage with the world. A large part of child development depends on how they engage with different people, different spaces,
So you say yes.
learning spaces. And so I strongly, strongly recommend that it must open.
Dr. Lim, Britain is slowly opening up. Do you believe it's the right way for the world to go? I mean, we can have Euro soccer, Wimbledon, and the Olympics with adults all over without social distancing and some without masks as well. But what about children?
Sure. Of course, the difference between children is that, one, they are not vaccinated in the UK. We've got pretty good data in the UK that when children started going to school, the rate of spread amongst children in school is very low. But if the background rate of infection goes up, children then bring it into school from home. So it is not really the school that is the problem. It is the background rate. So we strongly, recommend that, children get back to school. But of course, the track and tracing needs to be very good so that, the minute someone's infected, then the correct containment, whatever your local policies are employed.
Dr. Gulati, linked to this, is it linked to the whole vaccination program that now that various vaccines for children are likely to come out, to emerge over the next 6 months, should children go to school only once vaccines are available and once they are inoculated?
See, because our population is very huge, and the percentage of adult population also, which has been vaccinated is less, because of the numbers. It's slowly taking time. So I personally feel that we'll have to go cautiously when we waited so long. So we can just expedite the vaccination part, and then it will be very much safer,
No, but are you saying children need to be inoculated before they go to school, or adults need to be inoculated before children can go to school?
See, I think it's a relative proportion of both, adults also, and I ultimately feel even the children obviously should also be vaccinated. That's why the trials are on, because ultimately when the adults get vaccinated, once you're vaccinated, you can still spread the infection when you get the infection.
Dr. Lim,
so
very
if
quickly.
the children start getting, and then, they will start giving MISC after that. And
so you're saying be cautious.
Problems,
So you're saying being a little cautious. You're suggesting, Dr. Gulati, to be a little cautious before we go ahead with reopening. Dr. Sen would like reopening. Dr. Lim, one final question coming in for you. Should children take any special diet to ensure that they are COVID protected?
Not that we would recommend, but of course you probably know about the story about a good healthy diet and vitamin D. But I think that's not taking it now when you have been malnourished for a long time isn't going to change the story, but having a healthy diet would prepare you for fighting infection. So it's a holistic approach rather than a very specific dietary approach.
A final question to you, Dr. Sen. How do you help children dealing with grief? There's so much of grief, as you said, there's anxiety, there's grief. They're hearing stories about people dying around them. They're staying at home, cooped up. How do they deal with grief?
Yeah, so that can be a very tough one, but particularly if somebody from a close family member has passed away, especially if it's a parent, and we have had so many such instances. And I think, again, creating that safe space where, the children have support from the immediate family and also have the space to be able to express themselves. So again, the place at home that you're saying this to, the age-appropriate language and the sensitivity with which you are conveying the message. But, while you are saying that this is indeed a definitive event and there is no coming back from it, but at the same time, tell the child that there are many other people who will step in to support them during that time and who will take which role. Because the immediate thing that children go through is that then what's going to happen to my life? So to be able to normalize that and to be able to stabilize their life, we have to actually plan it and bring it in fairly quickly. Again, sometimes, the parent who is surviving is perhaps not the best person, because they might break down in a manner where the child, in such a helpless manner, that the child might feel even more helpless than before. So it's important to choose who would be the person who will step in this scenario to be able to convey this news, and with the sensitivity and the emotional holding that is required.
These are tough issues, but we are having to grapple with them in COVID times. Children need to be protected, and I appreciate that all three of you have taken the time off to give us answers to the most frequently asked questions. Dr. Lim, Dr. Gulati, Dr. Sen, really appreciate your joining us on the Doctors Roundtable. Thank you so much.
Thank you very much for having me.